In the ongoing global health conversation, obesity is typically cast as a precursor to heart disease, type 2 diabetes, or joint problems. Public awareness campaigns focus on cholesterol, blood pressure, and blood sugar, but far too often, they leave out one of the most chilling outcomes linked to obesity: cancer death. The connection between obesity and cancer is no longer a matter of debate. What remains dangerously neglected is the fact that excess body weight does not merely raise the risk of developing cancer, it also contributes significantly to cancer mortality. This omission has deadly consequences. In recent years, obesity has become one of the fastest-growing preventable causes of cancer death, yet it remains one of the least understood by the public and even underestimated by many healthcare providers. Unlike smoking, which is now universally recognized as a major carcinogen, obesity hides in plain sight. It doesn't carry warning labels. It isn't stigmatized in the same way, and it doesn't trigger the same level of political action. As a result, its true cost, in lives lost to cancer, is quietly mounting. Obesity contributes to at least 13 types of cancer, many of which are particularly lethal. These include breast cancer in postmenopausal women, colorectal cancer, pancreatic cancer, liver cancer, endometrial cancer, and esophageal adenocarcinoma. These are not fringe diagnoses. They represent some of the most common and deadly forms of cancer. In obese patients, these cancers tend to be diagnosed later, grow more aggressively, and respond less predictably to treatment. What's particularly insidious is how obesity influences cancer mortality on multiple levels. First, it alters the body's internal chemistry. Fat tissue is biologically active and secretes hormones like estrogen, insulin, and insulin-like growth factors, which can accelerate tumor growth. Chronic inflammation, commonly seen in obesity, damages cells and supports an environment ripe for cancer proliferation. Immune dysfunction, also associated with excess weight, undermines the body's ability to detect and destroy early cancer cells. Second, obesity physically complicates the detection and treatment of cancer. Tumors in obese individuals are often harder to spot with imaging, meaning diagnosis may be delayed until the disease is already advanced. Standard treatment plans may be less effective. Chemotherapy dosing is complex, surgical risks are higher, and radiation targeting becomes more difficult. Many clinical trials still exclude obese patients or fail to report how weight status affects treatment outcomes, leaving doctors with little evidence-based guidance. This translates to worse survival rates, even when care is accessible. There is also an institutional blind spot in how cancer risk is communicated. While oncologists and researchers have increasingly acknowledged obesity as a major driver of cancer progression and death, this hasn't translated into public education. Government guidelines still tend to mention obesity in relation to heart health and diabetes, while cancer prevention messages continue to center on tobacco cessation and routine screenings. While those strategies are crucial, omitting the obesity-cancer link from the conversation does a disservice to the public. People cannot protect themselves from a threat they don't fully understand. Even more troubling is how this silence is shaping health outcomes for future generations. Rising obesity rates in children and young adults are now being tied to increasing rates of early-onset colorectal and other obesity-linked cancers. These cancers tend to be biologically more aggressive and strike during working and reproductive years, with devastating personal and economic impacts. And yet, young people are rarely told that the weight they carry today could significantly raise their risk of dying from cancer tomorrow. In developing countries, the picture is even bleaker. As processed food diets and sedentary lifestyles spread, obesity and cancer rates rise, but healthcare systems often lack the infrastructure to detect or treat either condition effectively. There is little cultural awareness of the obesity-cancer connection, and almost no policy action aimed at preventing this double epidemic. People are dying not only because of the disease but because of institutional neglect and silence. We must acknowledge that cancer deaths linked to obesity are not the result of individual weakness or vanity. They are the consequence of systemic failure, of industries that profit from ultra-processed foods, of governments that fail to regulate harmful marketing, and of public health systems that have not kept pace with shifting disease burdens. These deaths are preventable, and that makes them even more tragic. To reverse this trend, a multi-level strategy is essential. Education must reflect current science and emphasize the link between obesity and cancer mortality. Public health campaigns must treat obesity with the urgency and clarity it deserves, not just as a metabolic issue, but as a direct contributor to cancer death. Policy action must target the root causes: food environments, physical inactivity, social inequality, and corporate interference in health messaging. Cancer is not always preventable, but many cancer deaths are. When obesity remains invisible in the cancer narrative, we lose a powerful opportunity to save lives. The silence around this threat must be broken. If we fail to act, the statistics will continue to rise, and they won't be abstract. They will be names, faces, and families broken by diseases that didn't have to claim them. This is not just a health issue. It is a crisis of awareness, responsibility, and prevention. And if we are serious about fighting cancer, we must start fighting obesity not just as a risk factor, but as a killer in its own right.